Hey guys, welcome to my channel. My name is Lauren and I am a licensed clinical social worker, board approved supervisor, and private practice owner. And on my channel, I give you all the tips, tools, and honest conversations you need to hear in order to succeed in this profession. My goal is to help you feel more confident and competent in the work that you're doing. And today we're talking all about what makes good clinical supervision. I myself have had good clinical supervisors and supervisors who really needed some more support in order to be better clinical supervisors. And I have also heard from so many people in the profession that they did not have good clinical supervisors, or their supervisors were just lacking in certain areas that they really would have benefited further as a growing professional if their supervisor had shown up or been able to show up a little bit differently for them. And so today we're going to talk about the top 15 things that I think make you a good clinical supervisor. Now, this video is for people who are currently supervisors, people who are thinking about becoming supervisors, individuals who are looking for clinical supervision and wondering who do I need to look for and what do I need to make sure I'm aware of in order to spot good clinical supervisors. And also for anyone who is thinking, I don't know if this is a supervisor thing or this is a me thing. And I want to figure out, is my supervisor giving me all that I need? Or is there something that is lacking that, if addressed, I could have better clinical support? So if you are any of those people or you just want to hang out, please stay tuned because we're going to get into all of it today. And I think there's going to be some really good information you can benefit from. As always, nothing said on my channel should constitute a replacement for good clinical supervision. Always make sure you're seeking support and talk to your supervisor because you deserve good support. Alrighty, so let's talk about what makes a good clinical supervisor. There are 15 things that I think really stand out that can make or break someone's supervision experience. And these are things that I have seen really help supervisees and individuals succeed under supervision. And I've also seen these things, when lacking in supervision, cause a lot of issues. So let's get into it. Okay, so the first thing I think is really important is making sure that the supervisor is available when you need them to be available. Now, obviously, everybody has their own schedule demands and conflicts that can come up and arise, and that's totally fine. But I have seen where people have actually said they had a really hard time getting in contact with their supervisor. Their supervisor was very rarely available, and it made it really hard to feel like that they could go to them. And a lot of times they felt like they couldn't because of strictly scheduled conflicts. So, a big part of being a good clinical supervisor or having good clinical supervision is the ability to feel that your supervisor is available. And in line with that, the second piece would be flexibility. Everyone's busy, everyone's schedules can change abruptly. And while we can't be available 24/7 as supervisors, and I really don't think that you should even try, I do think that there is a benefit to being able to be flexible and available when your supervisees or your employees or your residents need you to be. And so there may be some parameters that you set around that, such as how to get in contact with you after business hours, what to do if an emergency arises in the evening or on the weekends, and making sure that you're available to check in between meetings if there's something that arises that you need to address. But staying flexible with your schedule and staying as available as you can are two of the biggest things that I see really lacking in clinical supervision that need to be there. The third thing, I hope this is obvious, is a supervisor should be listening and they should be validating your experience. So if you're supervising somebody, it's really important that you are showing up for them just as if they were a client in a lot of ways. You should be attentive. You should be listening. You should be really tuning into what they're saying, what their pain points are, and really trying to understand from an empathetic lens, how can I help support you? I hope you're doing that with your clients already. But this is something that is so, so important. If someone feels like that you're not listening, then they're probably not going to tell you real, honest, open, vulnerable things that they really need to talk about in order to be better mental health professionals, to succeed in the job or the role that they have, and to make sure that they're not making really big errors in their practice. So, being empathetic and being able to be someone who listens before just talking and really tries to seek to understand is so important. It's such a good quality to have. And in line with that, I think that the clinical supervisor should also be someone who is warm and patient and validating. It's really important that if someone is coming to you and they have a genuine problem, concern, piece of frustration that they want to work through, that you're not automatically dismissing it. And if you've ever had a supervisor who has dismissed something that you said or minimized it, it's really not a good feeling to have. And it can make it hard to feel like you're taking me seriously and that you're going to do something about this. And I'm just kind of alone by myself here. And that can be such an uncomfortable, isolating feeling. So we want to make sure that as supervisors, we're showing up in ways verbally and non-verbally that show the person that we're supervising, I'm empathetic, I'm patient, I'm understanding, I am validating what you're saying and your concerns. Even if I don't agree with them, I'm still showing up in a way that says to you, I see you, I hear you, I want to help you, let's figure this out. The fifth piece is a quality that I often do not see have happen. And I think that more supervisors need to be aware of this and actively working on this. This is two parts. So, supervisors should be able to have a good clinical understanding of what is going on. You should have a good clinical skills and understanding of interview skills, motivational interviewing, different techniques and modalities that are out there, and genuinely how to help the client. I'm not saying you have to have the DSM-5 memorized. I'm not saying you need to know all the answers, but I'm actually saying you need to be able to have just a good basic clinical understanding of what's going on in the mental health profession, especially in the work that the person you're supervising is doing, in order to help them. And the second part of that is, if you don't know, don't pretend that you do. Part of being a good clinical supervisor, providing clinical supervision, is to be able to say, actually, I don't know. Let's figure that out together. Because me putting on an act that says that I know something that I don't know may cause me to give not good clinical advice or recommendations, or I could be giving you the wrong information, which that's not on you, that falls back on me. And so I want to make sure that if I don't know, I'm being very honest and open about that and simply saying, I'm actually not sure what the right answer is. Let's figure that out together. And then being willing to consult your own colleagues, seek your own supervision, do research, try to get a better understanding, try to get the answer, and help this person you're supervising get the answer that they need. Don't just say, I don't know, and end of conversation. Don't just say, I don't know, and send them on their way. Like, seek to help them figure out what that is. And it also gives you, as a supervisor, an opportunity to learn something too. And there's always something to learn. We're not supposed to know everything. It's just a matter of being able to say, you know what, I don't know that. Let's figure that out together so that we can make sure that you have the right information that you need. If you're not doing that, then again, you're really limiting yourself, but you're also limiting the supervisee that you're supervising, and you may end up actually be giving them not good clinical guidance, which that's not good. And in line with that, another quality would be making sure that you are a good collaborator. If there is something that's being discussed in supervision that you feel like is a genuine concern or problem, we want to make sure that as a supervisor, we are actively collaborating with them on how to solve the problem. It goes back to something I just said a minute ago. Telling someone, I don't know, go figure that out, is not the best clinical advice that you could be giving. And we want to make sure that I'm collaborating with you on how to together effectively solve this problem. Now, as a supervisor, I have my own duties. I have potentially my own caseload. I have my own stuff going on. And so I'm not coming in and saying, I'm just going to fix this for you. That's not what I mean. But being able to collaborate and work together in a way where it fosters this sense of connection and, hey, I'm here with you, let's figure this out, I'm by your side, you're not alone, we can handle this type of vibe that you're kind of putting off. We don't want to be so closed off that when someone has a genuine concern or problem, that we're not being an effective communicator or collaborator, and they're feeling like, wow, I'm no better off than when I came in to this meeting to begin with, because that's not a great feeling. Now, this next quality is something that I actually see a lot of people really struggle with, and I want to make sure that I'm very clear on this. So, listen up. When you are supervising someone, or if you are being supervised by someone, a good clinical supervisor helps you mold yourself into the professional that you want to be, that allows you and your personality and your interest and your strengths to all come together in this beautiful way and allow you to be the mental health professional that you are meant to be and that you want to be. Being a supervisor does not mean that I need to mold all of the people that I supervise or all of my employees into me and make sure that they would handle things the way I would. And they have all of the tips and tools and things that I have so that they are basically mimicking what I would do. That is not our job. And that you, as a person being supervised, feels that you are being allowed to just be who you are and to really help figure out how to pull from your strengths and pull from the things about your personality that make you who you are and make you relatable, and figure out how do you combine all of those things together and show up in a really unique and beautiful way so that the client gets you and all your authentic humanness and not this robot or this person who is doing everything the way that they were taught to do by somebody else without even having their own individualism, their own freedom of expression, their own interests and niche and modalities, and all of these things that just make you shine in your work with clients and make you stick out amongst all the other mental health professionals out there. So if you are a supervisor, it's really important to stay in your lane and help the people that you're supervising become who they are, who they want to be, the type of professional that they want to be, to really lean into interest and specific goals and trainings and whatever makes them, even if you would do something differently. As long as obviously they are practicing ethically, they're making good, sound decisions, they're not getting into really sticky, unethical situations. In those moments, you obviously have a duty to say something, and make sure that you're intervening and trying to help them get on the right path, the right direction. But aside from those big ticket items, letting them just have the freedom to be themselves and really encouraging that in whatever way that looks is really an effective, very important quality of a good supervisor. And I just used the word ethically. So let's talk about that, because another really important quality of a supervisor is to make sure that your supervisor, or you, if you're the supervisor, is practicing ethically and that they're ethically sound. Unfortunately, I have heard and seen people have supervisors who are not practicing ethically or above, good clinical practice. And they are unfortunately modeling that behavior to the people that they supervise. And so, as supervisors, we always want to make sure that we are practicing ethically and that our ethics are sound so that we can lead by example, which is another really good quality of a supervisor, and to make sure that we are also passing down good ethical clinical guidance and information so that the people that we are supervising are also getting very ethically sound guidance to make sure that they're practicing ethically as well. If you're a supervisor and you're not practicing ethically, then how can you expect the people that you're supervising to also be practicing ethically? We want to make sure that everything is ethically sound across the board. And if you're not practicing ethically, as a supervisor, from one supervisor to the other, I think you really need to take a step back and seek some consultation and really figure out if you really even need to be in a supervisor role right now, because that is really not a good place to be in. And that's not providing good, ethically sound clinical supervision. And if you're someone who is being supervised and you're like, I don't think that my supervisor is always ethical, then my strategy to you in addressing that would be to make sure that if you do see something or hear something that's unethical, that that's being addressed in the proper chain of command at your employer. But also seek outside clinical supervision as someone who's external or independent so that you are getting good, ethically sound guidance and support so that you are making sure that you're having all your ducks in a row and you're getting the right information that you need. This is another quality that I don't think that a lot of supervisors always handle and show in appropriate ways. And this is a really important thing that can kind of make or break how someone views the supervision that they're getting. And that would be that a supervisor is being able to give you praise and focus on things that are going well and encouraging you and being very focused on pulling out your strengths and celebrating them. Oftentimes what I see is that supervisors are talking more about things that aren't working, things that need to be addressed or changed, or they're really quick to kind of go to, okay, what is the next thing that we need to be talking about? When there's a client win, there's a success, there is the employee or resident or supervisee has done a really good job, or they've helped the client in some way, I think it's so important to stop and just have a moment where you're praising that and saying, wow, that's awesome. You did such a good job. And really validating that you can hear how well things went and how great they were utilizing those tools and the things that you've taught them, and really just encouraging them to continue to do that and pointing out things that are really going well. If the conversations are always about things that the supervisor thinks that you need to do to improve, that also doesn't make supervision feel very good, right? It's like, who wants to sit in a meeting or have a conversation with someone when all they do is point out things that you could be doing differently? That's not very uplifting. That's not very encouraging. As supervisors, we want to make sure that we are giving out praise and compliments and focusing on strengths and really taking a moment to reflect on all the things that the person that we're supervising or the employee is doing really well. And in line with that, the next quality is that the supervisor needs to be able to give good feedback in a non-judgmental or non-shaming way when needed. Being a good supervisor doesn't mean that it's all praise and no, confrontational things that aren't going well. And it also doesn't mean that you need to always agree with everything that the person that you're supervising is doing. We need to be able as supervisors to actually have good, helpful conversations that help them succeed. And if your supervisor is not able to do that for you, then that really limits you in your growth and the ability for you to be as successful as you could be in the profession. And so, as supervisors, we need to be able to give feedback in a way that is not criticizing, not blaming, not talking down to someone, but actually saying, hey, in a very non judgmental, very respectful way, hey, this is something that I think could stand to be addressed. Or, hey, I'm really concerned about this over here. We need to have a conversation about that. And we need to be doing that in a way where we are being respectful to the person that we're talking to. So supervisors should not be having open discussion with negative feedback being given in the middle of a group setting or in the middle of the lunchroom or where other people are witnessing this. This should be, if I'm going to give you feedback that I really want you to listen to and take note of and make changes about, I'm going to do that when it's just me and you having that conversation, because I don't want you to feel attacked. I don't want you to feel judged. I don't want you to feel like I'm ganging up on you. I want you to feel like, hey, this is really important and we can have this hard conversation. It doesn't mean that you're not doing a good job. It doesn't mean that you're not good at what you do. It just means that this is an area of focus that we really want to be attentive to and work on moving forward to help you continue to grow and be the best provider that you absolutely can be. And in line with something that I said earlier, another quality is to make sure that you as a supervisor are operating from a strength based perspective. So I really want to be cautious when I'm talking to someone who I'm supervising, that I'm not going into it with the mentality of, we are solely here to talk about all the things that you could be doing better. We want to make sure that we're encouraging and uplifting people, like I said earlier, and looking at it from, okay, what are they doing well or what are they really good at? And how do we play into that and utilize that to your potential so that you can really rely on those strengths, and we can make sure that you are growing in the way that you want to grow, and also you're practicing ethically, you're making good clinical sound decisions, you have the clinical skills and knowledge that you need, but we're leaning into that from a very positive strength-based perspective, not a negative, I'm only talking about your weaknesses or things that you could be doing differently, because it really sets the tone for your all's relationship, and it doesn't foster a tone that says, I'm warm, welcoming, I'm inviting, I'm non-judgmental, all the qualities that I've talked about so far that just really can make or break someone's supervision experience. Another really important quality of good clinical supervisors is to make sure that you can have hard conversations and that you are communicating in ways that are assertive. If you struggle with being passive or being passive aggressive or even aggressive in the way that you communicate, that's really going to negatively impact those that you supervise. And it's going to really put your all's relationship in a very odd place. And it's going to cause potential tension. It's going to cause fear. It's going to potentially cause someone to not come to you for things. And it also could cause you to, unfortunately, not provide good clinical sound guidance if you are being passive or passive aggressive and you're not having the ability to have hard conversations with people and saying, hey, we really need to address this. There was a different way that we could have approached that situation, or, I really don't agree with the way that you handled that case. Let's talk about why that might be. Let's talk about the ethics that are involved in that. Like, the people that you are supervising, you have the direct responsibility for. And so if you are not able to have good, assertive conversations with them, you're kind of averse to, or whether that be that because I don't want to have hard conversations because I'm just put off by the discomfort that this may cause. I want to be liked. I don't want there to be tension. If I'm struggling with those things as a supervisor, it's going to negatively impact the way that I communicate. And I might actually not communicate or address issues, which can then get worse. And so, as supervisors, we really want to stand in that place of I'm being assertive and I am talking about things that might be hard in order to help you so that things don't continue to feel hard moving forward. We want to make sure that we have good communication skills so that we are able to feel that we can connect with people, that they can connect with us, that we can have conversations that need to be had, and that we're still moving forward and we can still get along and there's not tension and all the things that can kind of come up as a result of poor communication. Alrighty, I hope you've hung with me this long because we are almost done. There's one more quality that we need to talk about, and that is good clinical supervisors not only advocate for clients, but they also advocate for the people that they supervise. Whether this is a supervisee or resident, whether there's an employee situation, good clinical supervisors are advocating for the people that they supervise in the ways that they need. It's so important that if you feel that you have been wronged, that you deserve better pay, that you didn't like the way a situation was handled, that you felt mistreated by another colleague, it's so important that as supervisors, we are advocating for the people that we supervise or our employees to be treated better, to feel more supported, to feel more compensated in the ways that they need, because people who are happy with their supervisors stay longer at jobs and places of employment and they maintain that relationship much longer than people who don't. People typically leave jobs not because they don't like working with specific clients, which I mean sometimes does happen, but the majority of what I see is that people are not leaving their jobs in mental health because they don't like the clients that they work with. They're leaving the job because they don't feel supported or advocated for in the ways that they need by their supervisor. And so, whether you're an external supervisor, whether you want to become a supervisor, or you're a supervisor of people at your place of employment, there's always an opportunity for you to listen, to tune in, to validate, to use all the qualities that we talked about and really advocate for them in the ways that they need in order to feel more supported and valued so that they continue to want to stay working in the mental health profession. If you do all of these things, I am confident that you are going to provide good clinical supervision and be considered a very good clinical supervisor. And I'm also confident that if now that you've listened to all of this, that if you decide to one day become a supervisor and you apply these tools, that you are going to do nothing but succeed. I'm genuinely curious if there's anything that you feel like that I missed on this list or aspects of a good clinical supervisor that I didn't include that you feel like are really important for everyone to know. Make sure you leave that information down in the comments below. And if you haven't already, please subscribe and follow along so that you never miss anything, because on my channel, we talk about all the tips, tools, and honest conversations that you need to have in order to feel confident and competent in your work in the mental health profession. Alrighty, guys, until next time, bye.